Man, look. So a few years ago, I was like most people, which I was having health insurance, right?
Yeah.
And my little one went to the hospital, got a bill $8,000 for a 15-minute procedure, and the insurance company said I'm not paying for it. And so I was pretty pissed off, as you could probably imagine. I had to write an $8,000 check to the local hospital.
What was the procedure for?
Tubes in her ears.
Tuesday. Okay. And why did they not cover it?
They just said it was medically unnecessary, even though she had literally a hole in her eardrum. They said it was medically unnecessary, so they weren't going to pay for it.
Wow. Okay. And what were you paying per month for insurance?
$1,200.
You're paying $1,200 a month for insurance for a service that they didn't even want to perform.
Exactly. And so, after doing some research, what I found out is that almost 20% of the claims are rejected by health insurance plans. So this is their game, right? They say, yeah, we'll pay for anything, and when you submit the claim, they say no to 20%. They hope that you'll, just ignore it and move on because that's money in their pocket. If you fight it, then that's what you actually need to do is fight it. I didn't know it at the time. I know it now, but it's just this game that health insurance plans pay.
Which is crazy because people have to work so hard to put food on their table, especially if you have children, you have so many bills, and people have all these student loans and all types of debt that they got themselves into because they were brainwashed into doing it.
Yeah.
You're not going to have the energy to fight this stuff, and they know it, and that's why they do this stuff.
Exactly. I mean, it's so complex that they're like, nobody's going to fight this, and so we're just going to say no and see what happens. I mean, it is a absolute, from my perspective, scam that we're doing this. So it's paying $1,200 a month, so that's what almost $15,000 a year, and so I got to this place like I'd have to have something pretty big happen for it to be more than $15,000. So why am I paying into this when the probability of them actually paying when I do have something is low? And so it just didn't make a whole lot of sense to me that I would keep paying my hard-earned money for something that is not going to work.